we go.
Topics and tea. Topics and tea. Topics and tea. Topics and tea. Welcome to Topics and Tea.
Welcome, 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 everyone. I will stop sharing. I'm so excited to have you all on the call today. Can you all see our lovely faces? Good morning, everyone. Welcome to Topics and Tea. We're going to kick this podcast off now. And I want to welcome everyone to the first of 6 Topics and Tea sessions with a familiar face to some, for some, in some Alexandria circles, but maybe new to many, and that is Miss Alyia Gaskins, who is running for one of 6 seats on City Council. There she is waving in the lovely green. You can learn more about her at www.alyia, the word for, alexandria.com, and she is one of our special guests for today, but our main focus. The purpose for these tea and topics is for the public to start their morning with their favorite beverage. I hope you all have it. To your coffee or water, unwind and begin their day being heard as well as being informed. These sessions are meant to be informal. We have questions that residents submitted in advance, and we'll also dialogue with those who had time to join us today, like yourselves. And for our guests, we don't expect the candidate to answer all questions, rather engage in an exchange of concerns and ideas. Key questions and themes from these dialogues will be summarized in the campaign's blogs. We will also have a special guest, Jennifer Ayers from Alive. Hi, Jennifer. Welcome. She's the executive director of Alive. This is an emergency food program here in Alexandria. So welcome to you both, because we brought her on because we have some questions concerning health COVID that is very related to food as well. And I see some more guests, and we're going to let them in now. Great. So welcome to all the guests who just joined us. So let's kick this off. First question. Alyia, let's set the atmosphere and start with an icebreaker for you and for our callers. When I say the word COVID, what are your immediate thoughts? And we'll start with you, and then we'll ask some of our callers as well.
Well, good morning, everyone, and thank you for joining me. I know most of us are probably going to be on Zoom calls and meetings for the rest of the day, so thank you for getting up a little early to spend some time in conversation with me and others in our community. Jennifer, I think that's a really great question, and the first word that comes to mind for me is family, and I say that because that's the thing I've missed most during this pandemic, not being able to see my family and to hug them and to spend time with them. So with that, should I call on someone else? Or
Sure, you can.
Okay. Robert, I'm going to call on you. What's one word that comes to mind for you when you hear COVID-19?
Robert may have stepped away. How about Hope or Danian?
Good morning. I can go. I'm going to have my, there's some busyness going on behind me, so I'm going to keep my camera off, but I'm waving to you from behind the camera. So for me, I would think that one of the major focuses, one of the words for me would be patience. This has definitely tested my patience and required a lot of patience. So that's what I'm hooking mine on.
Family, patience. Mr. Burns, I see you came off mute.
Sorry about that. And we have a contractor in the house, so I had to step away for a second. This is related to COVID and
yeah. What comes to mind when you hear?
Disruptive and equity.
Wow.
Especially health equity.
That's excellent. Danian? What comes to your mind?
Good morning, everyone. I think the thing for me that comes to mind is community, simply because, throughout this, the things that are happening with different families, the concerns, rental assistance, evictions, food poverty, we have come together as a community to reach out to our community. And so that's the thing that comes to mind for me.
These are excellent. So, Jennifer, would you like to add on to that?
Yeah, I would echo Janine as well, but I would say also resilience and response. From where I was sitting early in the pandemic, the first question was, what are we going to do? Are you ready? So we got ready really fast with our food distribution, and then we've kept building. So I think that response and that resilience from our community, everybody's really helped us, and that's amazing.
That's awesome. Thank you. So to the candidate, I heard words that came to mind were family, patience, disruptive equity, health, community, resiliency, and response. So thinking about all of that, I've been looking at the news lately, and also reading the Alexandria Times and seeing how we've had to quarantine a lot due to COVID, and how in some ways, whether in the US and around the world, how that's probably improved some of the climate and some of the health for many cities, especially in places where there was a lot of pollution and emissions decrease, et cetera. Well, on the flip side, it's also caused a lot of health conditions. And I heard that in some of the responses. So could you take into account the phrases that you've already heard that comes to people's minds? What type of health conditions do you think we're actually missing when people are staying indoors?
Well, Jennifer, that's a really good question. So if I'm taking into account some of the responses I heard, one of the words that sticks out to me is Robert's word of equity. And for the pandemic, we know that the greatest public health advice we've received is to shelter in place. But we also know that not everyone has the same conditions in their homes. And so some of the early work I did when I worked at the National League of Cities was working on partnerships around healthy housing. And so we know that a healthy home is one that is dry. So there's no leaks or no moisture or anything that could cause mold. A healthy home is one that's clean. A healthy home is one that is safe, well ventilated, no pests or rodents, no lead, well maintained, not overcrowded, energy efficient. And that's a lot, that's a lot of factors that there are people in our community who may not have those same housing conditions. Even if they have just one of those, let's say maybe because of the high cost of housing in the city, maybe they're living in an apartment, but that apartment has 5 or 6 people. And so when you're sheltering in place, yes, it may be, keeping you safe from transmitting the virus outside of your home. But inside, there may be things that if you have a respiratory condition, or if you have other illnesses, or maybe you're prone to falls, or it's a crowded space, like all of those things can also have an impact on your health, even though you're staying inside. So that's one thing that comes to mind for me. The other thing that comes to mind is just, hearing some of the thoughts around family, patience, resilience, community, just thinking about mental health and how the pandemic has impacted our mental health. I know, we're connected through people. People like to be around people, and being in a space where that's not as easy and your support systems are all outside. And so not being able to connect with them as quickly. I think that's another important toll that, mental health issues are often unseen regardless of a pandemic. But I think even now with people not being able to connect as quickly, those issues are further exacerbated. But I would be curious for others, any that I missed. I don't know, maybe Jennifer, we can start with you.
Yeah, I think you covered a lot of some of the key points, especially overcrowding. The other thing I would say is just access to healthy food, access to cleaning supplies. And that was certainly true for us early in the pandemic. It wasn't just the request for food, but also nutritious food. And then also cleaning supplies, masks, hand sanitizer, all those things that we sort of take for granted. A lot of our clients just didn't have any access to or any way to buy. They might have a cell phone, but they don't have access to internet to order from Amazon to have it delivered to their door. So we've also become this distribution hub for a lot of information and a lot of safety tools, gloves, masks, hand sanitizer, all of those kinds of things that people need, as well as cleaning supplies. We did give out cleaning supplies early on, access to diapers, some of those basic things that people need every day.
Yeah, that's
Wow.
a great point. I remember, so my church back home, actually, one of the things they started during this time is what they're calling the paper bank, where they've been collecting paper towels and toilet paper. Because you're right, one, it's just hard to find those things at the store, but often those things, you know, they add up in costs. And if you're already struggling and trying to make ends meet, being able to also pick up some of those things at other distribution spots is really helpful and important.
Is that something you think, Jennifer, your organization will continue to do beyond the pandemic, knowing now that how crazy it was with the, I was about to say the eradication of toilet paper, just, is that something that you guys have been thinking about?
We continue to do it when we have those kinds of donations available. So FEMA was able to supply a lot of hand sanitizer to the city and then distribute it through us. We still have groups donating masks. So whenever we get a large mask donation, we add it to our food distribution. We even did lights for pedestrians recently because we know a lot of people are on foot and those were donated to us. So when we get a donation of supplies, we're happy to distribute it. But our main objective in those mass distributions is to distribute healthy food. So that's been our primary focus. But hey, if you have something good that will benefit our clients, we're going to continue to give it out. We don't think that our numbers are going to shrink all of a sudden. And in fact, we see a steady increase. So we're not the big jumps we saw in the summer. In the summer, we saw once that first unemployment check ended, you know, they had the aid, and then when that was cut off, we saw a significant jump in our numbers. And then it's been just steadily increasing. So we're at sort of a level where we're okay, and it just creeps up a little bit every time we do a distribution, which tells us that need is still really out there. We also found as we opened up our pantries, and some of those are doing food distribution, we're serving the pantries, we're supplying all their food. We thought, oh, maybe some of our mass distribution numbers and our drive-through numbers will go down. Not the case. They remained steady or increasing. So there's just more food going out in more ways. So it's more and more, which tells us there's still such a significant need. And if we can throw in supplies, I think that's great. So.
Wow.
Thank you.
Go ahead.
Oh, sorry. I know. I was going to say, I think you raised such a really good point that often we don't talk about, which is the economic impacts of this crisis. You know, unfortunately, as much as we wish this was the case, they're not going to end with just the next relief package, or they're not going to end as soon as we get all of the vaccine out. Like, we're going to be facing some of these things for years to come. And I think really figuring out how do we build upon programs like yours, as well as other efforts that the city is doing to make sure that people still have access to resources that they need in order to be able to get back on their feet, or even just stay on their feet. Because we know, for a lot of people, you're one paycheck away or one crisis away from facing eviction or other challenges.
Dogs are welcome to Topics and Tea as well. So we also want to hear, I know the candidate would like to hear from some other callers as well, Mr. Burns or Hope or Danian. Please shed light. I see Mr. Burns put in that access overall comes to mind for him, particularly for residents who work multiple jobs, how to access healthcare. I know you said you have a contractor there, Mr. Burns. Would you like to elaborate on the whole aspect of the access to healthcare?
Yes, to me, it's been an issue before the pandemic, but how do you get to a doctor if you're working multiple jobs and you have lots of residents that do that? And how do you, a lot of those individuals certainly have struggled with insurance in the past. Affordable Care Act helped in some regards, but we know a lot of people still are uninsured. But I think COVID's brought out, how can we get creative about access to public health? And not that I have any solutions, but I think Alexandria is kind of a nice sized city to figure that out. And Alyia's background, I'm hopeful that she could bring ideas around that.
No, that's an excellent point. Excellent point. Hope or Danian, did you want to offer something around that question as well? What health conditions are we missing?
Yeah, for me, and let me see if I can phrase this properly because it's in my brain and I haven't articulated it.
Take your time.
For me, I feel like so many pre-existing conditions have been put on the shelf due to COVID. Like, I know that even my family, down in Florida, things that they would be going in to maybe take care of or to maybe see a doctor about, they've not, because they're in a high risk group, and say, well, the the balance of, do I want to expose myself to something in a health facility versus can I just wait? How much longer is this going to go? Can I just wait a little longer, before I go in and get that addressed? And I feel like that spans kind of across the economic spectrum, really. And I mean, to me, it's certainly a public health consideration.
Hope, you touched me there, because I'm going back and forth. I'm like, can I wait a few more months before checking on this issue? Can my parents wait a few more months before checking on that issue? Some doctors' office are very keen on letting, there's only one person in, and so we've had to kind of, talk back and forth with a few doctors saying, no, like I need to help my spouse, or I need to help my, parent, because they cannot walk into an actual doctor's office by themselves. And so we've actually foregone a few doctor's appointments because they are just as scared as we are, and because their regulations for 2 people were too strict. So it's just, you really touched that. So thank you so much. Damian, did you want to add anything to this question?
I think I would just echo what everyone was saying in regards to access, because when you think about access to healthcare, look at technology and the movement to video or virtual visits. If I don't have access to internet or reliable internet, how do I have a video visit with my doctor? Or if I don't have reliable cell phone service, again, how do I have a phone visit with my physician? The other thing I think that comes to mind as well, as at the beginning or the height of the COVID pandemic, the very first call that I got was my son calling me because he recognized that I myself have a pre-existing condition. I have lupus. And he said to me, Mom, do you have your medication? Because I just saw a news story that the medications are in short supply. Are you okay? And, in that conversation, the first thing I thought about not was myself, was, oh my God, what about all these other people that need this medication and now cannot get it? What are they doing?
Yeah, I think, Danny, I just want to touch, because your story resonates with me for 2 reasons. One, my cousin was diagnosed with lupus. Unfortunately, she passed away when she was 13. But lupus has been a disease that we have spent a lot of time in my family learning about. We all do the End Lupus Walk every year and are just really passionate about working to find a cure. But also, my mom has a number of health conditions, from asthma to diabetes to sarcoidosis, and she lives in Pittsburgh. And I made a call very similar to your son, trying to figure out, how do we make sure she's supported? She does not drive. And so some of the conversations here where we've had about access, I'm used to her catching 2, sometimes 3 buses to get to her appointments. And there was a piece of me where, when her doctor said it was still safe for her to come in, I'm sitting here like, but Mom, you cannot go. Like, how are you supposed to go and hop on all of these different forms of transit? Or I was like, I don't know, do we put you in an Uber? Is that worse? What are the different options for us to even get you to the appointment when it's open? And I think that, whether it's around issues of access or just, I think an underlying piece that so many people have been dealing with has been uncertainty in this pandemic. And how do we have clear and concise communication about which appointments you need to go to? How do you get there safely? How do you protect yourself along the way? I think we're getting better at that, but especially at the height of the pandemic, there was just so much confusion, and it seemed like the information was changing every single day. And that's a lot if you're somebody who's able to get all of that information. It's on your phone and, Googling and everything else that we do. But it's even worse, I would imagine, when you don't have the access to be able to sift through those things, nor the time to be able to do that. And I think that that's an area where I'd love to see us, like I said, we've gotten better, but continuing to improve and continuing to find ways to do that in different languages, but also different modes. It's not just our traditional, let's put it on the website or let's send it out through a city city notice, but like, how do we get the information to where people are in their communities, and piggybacking on other things, whether it's putting up places where people work or the distributions that Jennifer's running, or just other ways of getting information out there. I think it's going to be really important as we move forward.
And that's so important. We also find what's very helpful is working in communities. So we've really tried to work with the city to be strategic about where we're doing our distribution. So our two major ones, they're really for everybody, and they're more or less centralized, West End, North Side. But we do pop-ups, which a lot of people don't know about, through the week in neighborhoods where we know there's high need. And what we see there is access. Not only, can they cross the street to get to the supermarket? They might not be able to because there's a highway in the way. What kind of food are they interested in? Is it culturally appropriate? So when we can work with a neighborhood partner that can help us identify that need, we can be a little bit more responsive to that community. I think the other thing we're seeing, and you all touched on this, was the overcrowding issue. So we know that COVID spreads most commonly family member to family member. And people don't necessarily want to take a day off from a job that's already part-time. So we see the spread much more significant in communities where they're challenged to find jobs and keep jobs. And on top of that, we add scarcity of food. So one of the things we're doing is quarantine food. So, and that's really our charge with the city is, if people are in quarantine mandated and they don't have access to food, we're preparing bags that are then sent out to those people. And those numbers have not decreased at all. So we say we're kind of in the second wave, and we're seeing a real peak in the number of people who are in need of that food. And it's a constant demand. And not only just food, but nutritious food that you would want to eat if you're not feeling well. So and we don't know for sure if everyone in that household is really staying where they're supposed to, because they're so challenged for work. So in terms of the spread, education, I would say trusted partnerships, and then again, that responsiveness to what the community is needing, all seem to be critical and recurring issues.
Yeah, I love this idea of pop-ups, because I think, to Rob's question about how do we get creative, I think, meeting communities where they are, I wonder what public health pop-ups would look like. I know we have a lot of capacity challenges, but as we think about what's the capacity we need to be successful for our public health workforce, how do we have pop-ups around, prevention or information? I know we used to have kind of a wellness on wheels, like mobile bus or something, or mobile van. What does it look like to staff those up, not just for information, but, could they be vaccine distribution centers? But I think thinking about that, I also think, unfortunately, we are going to have a lot of vacant spaces due to the small businesses that have had to close. And while those vacant areas, sit unused, is that a way where we, can lease or get creative about the space for our public health infrastructure, to be able to have those as like little hubs where people can come in and out and get the information they need. And Rob, I just saw your point. I also think, the partnerships with Inova, really thinking creatively about how we leverage them as an anchor here, and now an extreme anchor on the West End with the redevelopment of Landmark. But I think all of these present opportunities for us to think creatively about how do we meet people where they are, how do we think about success, but also how do we build the infrastructure for a successful and robust public health response, not just to COVID, but unfortunately we have other public health challenges, from climate change to opioids to hunger. And so how do we really make sure that we're staffing up for the long term?
It's funny. We were having a similar conversation yesterday with our eviction group, just about how can we leverage those outreach opportunities to get people vaccinated, as well as that a question we should be asking when we're doing intakes on eviction, because they might have a cell phone again, but all the process to register for a vaccine requires access to the internet. So if you're a food worker, you might not know what your employer even registered you, because you might not get that email from the state saying you're qualified to go get your vaccine. So is there a way to do vaccine distribution in high need neighborhoods where people definitely don't have that access to internet? So that may not be our charge, but we certainly think it's a pervasive and ongoing issue.
And I love you brought that up.
Sorry,
I was going to say
great.
I was going to say one quick note. So it's not off the ground yet, but this is in my professional hat, but we do some work in Connecticut, and a group of funders have come together in Connecticut to think about what's the role of philanthropy in helping with some of these challenges, and where could they be most helpful. And one of the proposals they've talked about is, at vaccine distribution sites, can those also be spaces to do housing counseling, to provide rental medical assistance, to basically connect to other services and supports, or vice versa. If we already have sites where we're doing, where we're meeting with people around eviction prevention and helping them with resources there, or we're doing food distribution, how can they be paired? Because most of those are already set up in community, and they've already set up a structure around, social distancing and all the COVID practices. But what does it look like for those partnerships? So I will send you some information, because it seems like Connecticut is at least getting some resources to be able to test and experiment with some of these models.
I love it. Information exchange. This is good. This is what we're here for. You guys brought up a lot of amazing points just in that one conversation around that question. And so I had a few questions laid out, but I want to skip to a different question that specifically talks about communication in some hard to reach places. So, and I want the callers to kind of address this first before the candidate, because I'm curious, and I'm sure she would be too, to know your take on this. So in the face of a crisis like the one we're in, what ways could a city like Alexandria be more prepared with communication with our residents, especially hard to reach populations such as our immigrant populations? So for some of our callers, please chime in first. So we have Hope or Robert. Yes, please.
I'll put out a couple of thoughts. One, a lot of us might have gotten this last night. I did appreciate the phone call that came about vaccine distribution, and it seemed like it was an automated city call. We got it both on cell phones, and then we still have an old-fashioned landline, mostly for the alarm system. But I thought that was a good idea. But I think text is certainly a great idea to try to get more word out there. But the other thing I've thought about is, could you, especially places like laundromats and other places, I'm thinking specifically like our Landry and other areas, could you get word out in that way by meeting people where they are? Just as a thought.
No, that's great. Thank you. Hope or Danian?
Yeah, it's funny that Robert brought up the call, because I got that last night, and we also have an old-fashioned landline as well, and so I'm receiving it on my cell phone, and my husband's upstairs receiving it on the landline, and that got me to thinking, like, this is a really good step. But as I recall, I had to opt into that communication service, and I did it, I'm sure, eons ago, just for just the emergency line. So yeah, I don't have any good answers, but it got me to thinking, how can we expand kind of that level of communication? I really appreciated that it was the full message in English and Spanish. I would love, in a perfect world, to say press 4 for Farsi, and that, because I'm just thinking of our neighbors and where they're coming from. But I love the idea that Robert brought up as well, about meeting people where they are in, gathering places such as they are right now in COVID, to get the word out that way as well. But it was a great start last night. Like, I was happy to have that, but I just felt like, gosh, like that's still missing a pretty large segment of the population.
Great points. Great points. Danian?
Yeah, I think they both bring up valuable points, for that. I got that call as well, but again, you have to opt in to get that. And if I am not technology savvy and I don't have access to technology, and I don't know that that is something that's available, how then do I opt in? And so again, you do have to meet the community where they are. And so, text messaging. I know some of our community partners, they use WhatsApp to get things out to their members of the community. And I think we just have to think in terms of how people communicate in their native languages as well, because it's not just, some things are word of mouth. We are storytellers in some ways. And so some things do happen from one person to the other. And how can we get that story out? And it can't just be in written form.
Did we lose her? All
think
right.
so.
No problem. But I love what she was saying around consider how people best communicate, the storytelling aspect of things, because it made me think, I think this goes back to what Hope was saying, even if you have things translated in different languages, people may not read it wherever you put it up on a website. So I think that was an excellent point that she was making. Jennifer, would you like to chime in on that?
I would add also, like, there are literacy challenges for some of our populations. So
Absolutely.
even if it's translated into another language, they may not have literacy. So we've found that to be the case in some of our other programs, where people just don't know who to call, who to ask for help, what the form says, what do I say when I call, when they're accessing those services. So there's some real challenges, and a lot does travel word of mouth. We've had a lot of success reaching our clients on Twitter and on Facebook. And that surprised us a lot, because we thought, oh, they're mostly people who want to support us in different ways. And then we started getting questions. So we get questions on the back end, and oftentimes in other languages. So we have to do the Google Translate. Where is your food distribution? Or I'm hungry, where can I find a pantry? So those kinds of things come in the question sections of those social media tools. So we know there's a lot of people talking and helping each other out. When people come through our food line, it's also, I'm picking up for my neighbor, I'm picking up for my friend, so there's this definite networks within the community where people access information that are not formal. And we're trying to figure out how better to connect with some of those leaders. We have a list of social workers we send to that are on the ground, but we also now have some community partners who we talk to regularly. And, Casa Chirolog was a good partner. What's going on there? What do you need? And we go back and forth. The same thing with African Communities Together on the West End, which serves more of the Ethiopian and Somali populations that live like in the Southern Towers area. And they're, again, very trusted, and a group where we can say, hey, what's going on? Can you get this information out? So that relationship is so important. Yeah.
That's Alyia,
Yeah.
please. I'm sorry. I want you to go ahead, but Jennifer just put something in my brain about those groups. And I'm like, has council worked with those groups as well? That's where my mind is going. But please, Alyia.
No, I love that, because that was something I was thinking about in terms of not just how are we getting the message out, but who's the messenger. And what does it sound like? All of us would hearing here how we've been talking about word of mouth. It's really different when you pick up for an automated call versus when you pick up from a friend or family or neighbor. And so something I was thinking about was, for those groups that we partner with, are there ways that, the city might be able to compensate them, or even they'll sign up as volunteers to be able to help do some of these calls? Because then sometimes A, it's a number you recognize, but B, you're hearing it not just in your native language, but you're hearing it from a community member. It's almost like the concept of community health workers, but it's expanding it to, just community partners who are neighbors to neighbors, giving advice and information that is working off of a script that maybe the city or the health department has helped to put together. The other thing that came to mind for me thinking about community health workers was in this space, especially on the West End, where we have so many condos and apartments, reimagining this idea of like an apartment ambassador. Like, could there be somebody who volunteers and they're sitting in the lobby and find ways to do it social distanced, or find ways, when it was nicer outside, maybe we could have done it outside in apartment courtyards or parking lots, but thinking of ways that becomes a space to meet people, either through conversation, but through flyers. Maybe somebody from different representative organizations could be there to help distribute information. And then the other thing that just I've been thinking about is, everyone talked about the call they received, and I must be the only person on this call who didn't receive it. So I
didn't either. I don't know. I was already vaccinated, so maybe that's why. So who knows? But we're pretty connected, right?
I didn't get one.
And so really thinking about opt out services versus opt in. And so how do you reach more people, and then they have the ability to opt out versus opting in? Because I think that creates a barrier that like you said, even when we're connected, I must have missed the ability to sign into that.
It's almost like when we have to out of those, put our name on the do not call list, because you don't know how these people get your number, but they get it, and they will sell their information or their products or try to get you to do something. But I that's a very different way of thinking about it, Alyia. And it made me think. In a chat earlier, I was watching the BBC, and I think it was Israel. They have this. Apparently, it's running so smoothly. Their vaccination rollout, just because everyone is getting constant alerts. And it doesn't seem like anyone has opted out, but it sounds like the government has made sure that they completely they're all opted in first. So, Danian, I know you cut off earlier, but did you want to add anything to your thoughts?
No, I think everybody just kind of echoed what I was going to say, which is, Alyia said it best. Look at the messenger, because we partner with other community agencies, sometimes because they're the trusted partner within the community to get the message out and to ensure that people are getting the information that they need going forward. And talking about those apartment ambassadors, African Communities Together, they have a similar setup that they do that, where they have team leaders within the Southern Towers that go and actually go floor to floor, door to door, talking to people, trying to assist with services and getting people the help that they need.
It's almost like a campaign. Maybe we should think of the
Mhm.
vaccination like we're running a campaign.
Very
we should
grassroots.
yeah, we should definitely be pulling from other models of like grassroots organizing and mobilizing. And yes, there are ways that we can get creative on how to do it in a social distance fashion. I'm even thinking, I loved what you said about the team leader concept. People also love to feel as though they're contributing and that they have a role in the response and a role in the recovery. And so being able to give them an assignment, I think there's a lot of people who'd want to do that. I was talking to one gentleman, he's 80 years old and he lives in an apartment building. And he said every day he walks up and down the steps and down every single floor, partly because that's the way he gets his exercise and he feels safer staying inside. But he's also kind of dubbed himself like the apartment watch guy. But I mean, I'm sure if he had some flyers or he had some training, so he's already moving and in conversation throughout his building and being able to empower people to then give the information to those that he already cares about, watching his building and watching his neighbors. I'm sure and he'd care about being a part of the solution.
Wow. This is an amazing conversation. I'm really enjoying all the feedback here in the comments. So I want to take a couple of questions from a few callers that could not make it, but sent you some questions. And so we're going to get feedback from not only Alyia, but of course, those who were able to call. So this first question is from Megan, who resides in Old Town. She says, let's think creatively. What role could employers play in vaccination? Alyia, let's start with you.
A good question. Trying to think creatively, but I do think it comes back to a lot of what we talked about around communication. Okay. I don't think employers can, mandate that anyone take the vaccine. I think they're in a tricky space around what are the conditions they set up for employment, but also even when their employers do take the vaccine, there's a lot of things people worry about there around HIPAA and how information is shared. So I think it's a tricky space for employers. I think the best thing they can do is make sure that, employees have the information they need about when they're eligible, like what phases are we in? So when are they eligible for the vaccine? Mm-hmm. What are the things that they can do in the meantime in order to stay healthy and safe? What are the things that the company is doing? If the company is starting to have people working in person, or maybe they were never able to do work from home, what are the precautions and things that they're putting in place so that employees know about the conditions they're working in and the safety protocols that have been put forth. I think also too, how we've been talking about making information available, whether that's, making sure that people have the phone number for the public health department or a way to communicate and connect to others who might have information that the employer doesn't have, but at least they know all the spaces that they can go to ask questions. But I'd be curious what others think as well.
Let's see. Hope, Mr. Burns. Hope, go ahead.
One thing that, so I work at the Motley Fool over kind of up by the Patent and Trademark Office. Mm-hmm. Of course, right now I'm working from the basement, but but that's where our office is anyway. We've been out almost a year now, which is nuts. Yeah. But I was actually just talking with our office operations team the other day to see how, once the vaccine is more readily available, every year in past times, we had what we called a wellness day. and you could go down. We have kind of an auditorium, on the first floor, and you could go down there and you could get your cholesterol checked, or a number of other things, and you could get your flu shot. And my thinking is, obviously, because of social distancing, we would need to rethink how we lined up to do that. But I mean, to me, that just makes so much sense. I mean, that could knock out a maximum of 350 people, should, depending on who all opts in one swoop. And that would just be amazing. So the more and more that I think, mid-sized to maybe larger sized businesses in the area could take part in that, it would take the pressure off the public health system. It would take the pressure off your local CVS and Walgreens or your doctor's offices, free that up for people who really need those facilities. But since it's being covered anyway, insurance wise, it makes a lot of sense to me anyway, to make that kind of a walk-in affair.
Yeah, I love that idea, Hope, especially, I think right now one of the biggest challenges is supply, but once we start getting more supply and there's area, I think the demand is there. And so getting creative in those ways would be interesting. You're also making me think, when I was in college, they used to do pop-ups like that, but they would also be not just for flu shots, but also mental health resources. And so going back to what we talked about in the beginning around things we're missing, if employers are able to provide a space where you can get the vaccine, like, could you also access other supports and resources for things you might be dealing with?
That's excellent. My job also does that, Hope. So, so that's a great point. And Dadia, you want to add in? And Mr. Burns says thank you. He had to go to another call.
I think the only thing I would say is just adding flexible schedules for those that want to go out to get the vaccine, because sometimes, the only time you have to go get it is during work hours. And while I know as they're doing the vaccines, they try to get through people as quickly as possible. You could be in line for 30 minutes to an hour, and so maybe your standard lunch hour or time might not be just enough for an employee to go get the vaccine and come back. So I think, again, access. I love the idea of the wellness day. I used to work in a hospital, and I loved that when we could go and you would have the health fair, and you would go to the different stations, and each station was a different educational thing, and they would have some interactivity. You could get your wellness checks if you wanted, and it made it fun.
I would just add the small business community. So when you have a large organization, a hospital, a big corporate or a government agency, it's much more easy to administer those wellness days. But I think a lot of people, at least that we serve, work in very small businesses or sometimes off the books. So how we reach those people and how we educate those employers. Maybe you have a small company of 15, less than 15 employees. Those people also need that same access through their employer and that same flexibility, which can be a little bit more dynamic, I think, when you're running a very small business. So I love the idea of the wellness fair. I know Neighborhood Health was doing one annually for the community before COVID. So I'm hoping to see some of those kinds of things return, where people could take a few hours out of their day, wherever they work, and not just for the community, but for those small business people, to pool resources or somehow come together through so that they can get people what they need.
Wow. So that's a very good point. Thank you so much, Jennifer, for bringing up the small business aspect. So let's take one more question from a caller that couldn't make it, and it's related to distribution. So this is from Dr. Hancock on the West End. We know approximately 160,000 residents. We have 160,000 residents approximately in Alexandria right now. So, and according to the Alexandria Times, a recent article that I read, only about 2,000 doses were being received a week. And so I'm not a mathematician, but even if we had about 3,000 doses a week, we would only really reach our population at the end of the year in terms of everyone being vaccinated. So what would you say, and this is asked to Alyia and anyone who wants to chime in, what should city council members do or be focused on when they hear residents being so concerned about the majority of the city getting vaccinated So
It's interesting. I was listening to a presentation by the population health manager at the health department yesterday. And that's true. She said they're receiving 1,800 to 2,000 doses a week. She talked about how we're finally in phase 1B, but in 1B, I think it's ages 65 and older. And she said that that's almost 7,000 people in Alexandria. It's also frontline workers, which includes a lot of different categories, from public safety to childcare to grocery store workers, which is thousands of people. She said that it also includes people ages 16 to 64 with specific underlying health conditions that put them at greater risk of contracting COVID. And she said that that's tens of thousands of people. And that when you look at phase 1B across the state, that there are some estimates that assume that that's almost half of Virginia. And so the biggest thing we have is a supply issue. So I think from a council perspective, I think first, hearing those concerns and acknowledging they're real, like no matter what the data is, it's real. You feel how you feel, and we're all facing uncertainty, and we're all concerned, and we want to get back to some form of quote unquote normal. So I think hearing that and acknowledging is really important, and not being dismissive of those concerns. I think the other thing is we have to be on council as best we can, in partnership with the state and in the federal government, advocating as best as we can for as much supply to get here. I know, with the new administration, they have a robust plan and big ideas for how to get us more doses at a faster timeline. And so I think, making sure that we are advocating and making sure that those resources come to Virginia is key. And then I think there's the other piece of, being able to receive those. One of the things that the population health manager talked about is nobody's ever dealt with this before. And so they had to set up all new systems. And even like our hotline is used to receiving 20 calls a day. And now she said it's getting close to 300. And so I think that while we are preparing for more vaccine to come, what can we be doing, or how can council support? We have budget season coming up, and there's going to be a lot of questions around cuts, but this is an area where investment is needed. So what type of investment is needed to increase our capacity so that as more vaccine comes, we're able to deploy as quickly as possible, and we're able to start putting in the systems now to be ready to receive that.
I'm hearing prevention systems here as you talk, Alyia. So, and I think that's critical, because I think it's a question that part of the question that we asked you, Jennifer, earlier. It's just like after this pandemic, our systems have to be in place, because this is not going to be the last, right? And I think
exactly. Yeah.
Please add.
One thing we've really started to take a look at, and this isn't just with Alyia, but with other food banks and the Council of Governments, is what is the readiness situation? Because that was my first question, is, are you ready? And I said, well, I don't know. So we got ready really fast, but there wasn't this sort of data sharing across jurisdiction or across even food banks where we could say like, okay, I have extra refrigeration, you have extra cabbage, let's meet, So some real-time data in terms of who has what and how we can move it along in the food supply chain would really help. So keeping some sort of plan or some sort of system or some sort of reserve, so we're always ready, is very important. Since then, we've worked with City Council to put in a reserve of food that's always available, and that's something we will maintain. But that wasn't ever in place before. So this emergency response and this idea of being readiness is something that we all need to think about on, I think, multiple tiers. So for us, it's in a lot of different places. So it's, in Dunedin, in the shelter, like how do we prepare our residents? We had to figure that all out as we went along. Extra cleaning for our warehouse. So now we spray it down because we have volunteers coming there. So all of that stuff was not in place, and we've learned. And now we have to be ready to implement it at any time. And that's just a very different type of thing. So
yeah. Jennifer, earlier you had said something around like, how do we learn from other systems? Like, how do we learn from campaigns and places? And you make me think, even with our reserve supply of food, I think before COVID, there were a lot of conversations, and now even more, about our gig workers and folks who are picking up odd jobs. I think it was even with the scooters, like people, your job would be to pick up scooters and move them to a different location. What does that look like from a food distribution standpoint? Because your team might not always have the ability to leave if you're running a distribution, but are there other folks who could get a job being able to help move food across the city, or in the case of vaccines, once we have more supply, be able to move the supply in a a safe manner
Mhm.
to areas where we could do pop-up distribution. So I think thinking about that creativity, or even across jurisdictions, given the fluidity here, is, you know, networks for us to learn from and see what's worked and hasn't worked, and how that can be built into our system.
Right. You know, I think, you know, early in the response, you know, I heard someone else say this, it was like 1,000 flowers blooming at once. Everybody was responding and everybody was doing a lot, but there was no coordination. So until a couple months later, and then everything got really coordinated. But it was like everybody wanted to house. So there was almost like more than we needed, and groups picking up, I'm going to do a food drive, I'm going to do a food drive, I'm going to hand out this. And then eventually they get tired, you know, or they don't have the capacity, and it comes back to another organization to then partner and put more structure in. So to have that structure up front and to have that response and that readiness is so critical.
Wow. So we're about to wind down. We're going to ask about closing question. I was looking through my questions I had for all of you, and you really touched on a number of things around various health related matters that may be connected or not connected to the pandemic. There is one I really want to hone in on for both Alyia and Jennifer as our guests, as well as the callers. I remember in college, we would go to restaurants or food stores because there was always some good untouched food or products remaining at the end of the day. And it was going to go to waste. And so I guess when, like Mr. Burns was saying earlier, like, let's start thinking creatively. And as Alyia was saying, you know, making sure we're setting up systems and, you know, in advance, so that could kind of, help us move into the future with things more set in place to be able to withstand any future pandemics or barriers that we may meet. So I guess for me, I'm wondering, is there a way to either package food for the homeless, or even have restaurants offer things at discounted prices for families in need of dinners? I'm just trying to think about how can we, because it sounds to me that COVID definitely created more food insecurity, if you would say that, and definitely, as the expert, Jennifer, correct me, but it definitely impacted hunger. So I'm just trying to think about ways that council and community members can help improve waste of quality food.
Mm-hmm. It's an interesting question, and I think it's something we're trying to understand too. There is a group called Food Rescue that has an app that matches restaurants and hotels that have excess food, and then delivers that food to places that need it. So you need a place that, I think the biggest challenge is you need a place that can receive it. And there's also health codes, I think, that are at play there. So there has to be certain levels of freshness. And it's not necessarily prepackaged food, but that they do have a way to match those systems. And I know they've worked a little bit in Alexandria, but not as robustly as in other places. And I think part of that is the hesitancy on the side of the receiver to take food that may be left over and may not be as fresh, so or as healthy because of spoilage. From our perspective, we have worked with groups like World Central Kitchen. They came in this summer and they've handed out meals. We wrapped around groceries. A meal was good for one day. And that was great. That got the restaurants working, kept people employed, but we also know that family needs to eat tomorrow. So we were very concerned about making sure they had ready groceries. We continue to work with World Central Kitchen and others just to think about, how can we support each other? And I think if we can wrap around services where there's something existing or people are coming out for a hot meal, that works. We did one also at Charles Houston Rec Center with the local restaurant, Royal Restaurant, and a church, and they supplied meals. Again, we wrapped around food. Eventually the meals went away, the business improved. So we were able then to just do regular grocery distribution at that site, which serves a lot of ARHA residents. So it's sort of tricky. We are willing to partner with restaurants. I know that they want to keep people employed, but sometimes that cost share per meal that you have to pay the restaurant is much higher than it is for like shelf stable groceries. So if I did my math right, we distributed about 1.4 million pounds of food from March until now. And that's about a little over 1.1 million pounds of meal equivalents. So that, when you think about that quantity, if we had to do that many individual hot meals, it would be a much, much larger scale operation. Like many other food banks, we're also challenged with refrigeration. Like we have an outside container, we have a couple of trucks, but at that quantity, we can't keep things fresh. So if we get it Thursday and we can't deliver till Friday, sometimes that food's going to go bad. So there's a lot of logistical challenges I think we just need to always think about and how they work. So I love the idea. And I think that, through council leadership, maybe looking at some of those health codes and, education to our community might be something to think about.
Thank you. I was going to ask you that how can council help? Please, Alyia.
No, I was going to say something that comes through loud and clear, Jennifer, in the examples you provided is a lot of the examples were nonprofits and churches who are coming together to address this or explore with these different ways of distributing food. And I think what comes to mind for me is you guys are on the front lines, seeing this every day and navigating and trying to figure out those logistical challenges. And so how can council be a partner in listening and hearing where those gaps in delivery are? What are the hurdles or barriers that you come up against? And then what are the ways that we might be able to, either enhance the work that you guys are already doing or use our resources alongside yours to plug in some of those gaps, not just on food recovery, but on many different pieces of the whole, the food system. And as we talked about here, the public health system overall.
Right. The city has been incredibly supportive just in terms of the allowable space we can use and having access to trucks and working in partnership with quarantine delivery. I think one of the big gaps, and I've talked a lot about this, is data. So we know that we served, 28,500 households, but I don't know if they also went to Grace Episcopal's pantry. And I don't know if they are also on SNAP benefits. And I don't know how that family might be moving through the system. So to have some sort of citywide tracking, even if it's just by intersection where they live, would really help us understand where people are coming from for food. Is it a one-time or a short-term need, or is it a longer-term systemic issue for that family? So, so that's something in terms of data collection we really want to start to understand. In the COVID environment, we used to ask people just for household size. In the COVID environment, we're very contactless, so we haven't done that. But I think as we move forward in this new paradigm, we really need to think carefully about if we're giving food to a pantry, measuring how many people are coming for that food and who they are, so we can see if they're also coming to our mass food distribution. And they may, it's just a question of how deep is that need. We hear anecdotally a lot of people lost their second or third job, but is that person going back to work? So this is my voice.
That's right. That's why we have some tea.
Right.
So, yeah.
So anyway, it's working. So I think that data is so important. Groups like Hunger Free, Alexandria, are working with us on it. The Economic Opportunities Commission is taking a look at some of these issues. We've been really fortunate to work with Kate Garvey at the Department of Community and Human Services, who's a superstar in bringing people together. So those are issues everyone's aware of, and it's a matter of like, how do we figure this out? So having council support to look at that data and to make sure we're collecting appropriate data that can inform other programs as well. So if we know someone's being evicted, they probably have a food security concern as well. If they're homebound, they probably have some other issues, mental health issues or health issues in general. So we want to try to figure out how do we synthesize some of that and just be more efficient and effective.
So this has been an amazing conversation, this first TN Topics on COVID and health. And so I'm so grateful to both our guests, Jennifer Ayers from Alive. Thank you for all the work that you're doing in the community on food distribution. And I hope from this session that the public will understand even more of what you do and understand how to access you. Thank you to our candidate, Alyia, for Alexandria. Your wisdom is just amazing. Your spirit of creativity, I can say that I truly admire that. So we're looking forward to the next 5 sessions with you. And just to put a plug, the next session I did put in the chat here, it's going to be on education and child success. There was a question around COVID and education, so we're going to drop that in on that next podcast on February 18th at 8:30. I want to just make a couple quick announcements and then give it over to the candidate to make a final final comments. So just because we're talking about COVID and health, check with your doctor, your local pharmacy, and Inova Hospital to find out when you're eligible for the vaccine. Remember to wear a mask. Even if you got your vaccine, let's stay safe. Wear a mask and social distance. After vaccination as well, continue to wear your mask and wash your hands, because we're not fully out of the woods as an Alexandrian community. Donate blood as well if you can, as supplies are critically low. You can contact one of our Inova Hospital or your Red Cross in your locality for more details. The need is highest for donors with blood types O plus, O negative, B plus, B negative, A plus, and A negative. The status on vaccines in Virginia and the current data, you can go to the Virginia Health Department website and also identify which category for the vaccination you fit into. So that ends our announcements. And Alyia, you can, we'll end with your voice.
Well, I just will first thank you. Thank you for having this idea. I am having so much fun, and I took pages of notes, just learned so much. I think that's part of how I hope, I mean, it's not how, I think it is truly who I am. I love to listen and learn from others, and I want to be able to put forth ideas and solutions that are co-created as part of our community. And so I appreciate all the feedback I received today. So Jennifer, thank you for creating space for this. Jennifer, the other Jennifer, thank you for joining and giving us your time this morning. And to all of our callers who came, thank you for waking up early with us, sharing your ideas and engaging in these questions. I think that, we have some big challenges ahead, COVID being one, but I think if we can create spaces where we get to ask questions like this and we get to imagine what's possible, I think it really creates an opportunity for us to not just address the short term, but also to prepare for the long term and how we become a more resilient, responsive, community-driven community. Some of the words that we heard earlier today. So I'm looking forward to the next conversation. And if you want to learn more about me or the campaign, you can go to AlyyiaForAlexandria.com.
Thank you so much, everyone. And I'll drop that website in the chat right now. And we will then sign off. Thank you so much. Have a wonderful day.
Thank you.
Have a good day, everyone.
Have a good
Thank
day.
you.
Thank you. Bye-bye.
Thank you.